Okay, welcome everyone. So now we are going to look at the topic that is pulmonary embolism. Pulmonary embolism is a condition or it is a pulmonary embolism in cardiology requires stepwise clinical assessments. To manage pulmonary embolism in cardiology, we will have to follow some steps. Number one, clinical suspicion. We will have to look at some common symptoms like dyspnea, sudden onset dyspnea, pleuritic chest pain, cough with hemoptysis, tachycardia, syncope, hypotension. In massive pulmonary embolism, we will have to clinically correlate the signs and symptoms of the pulmonary embolism from the patient. Another one is risk factors. We have to look at if patient has surgery or if patient is immobilized or is there any active cancer, carcinoma or any lesion or history of deep vein thrombosis or pulmonary embolism, previous history, heart failure, if patient is obese or smoking heavily from history. And we will also have to look at some clinically probability scoring, like there is probability of scoring for DVT in which contains the pulmonary embolism diagnosis, heart rate more than 100, immobilization or surgery, hemoptysis or cancer or anything related to this. Then we will have to score the pulmonary embolism, or we will have to perform D-dimer test, and we will have to perform look at the, if there is positive, then proceed for imaging. CT imaging is done in cardiac patient. D-dimer test can be falsely elevated in the age, so we have to take care of that. Then imaging studies for CT pulmonary angiography and visualize emboli, or we can also look at the ventilation perfusion scan. And then we can also do ECG of the patient. Sinus tachycardia can be present, or S1QT and T3 pattern will be found, or right axis deviation with T wave inversion on V1 and V3 will be found in the ECG. Then we will do echo, and we will look at the right ventricular dilation and dysfunction or any meconial sign for the patient. So we will have to diagnose or rule out according to that. Another one is the lower limb Doppler ultrasound. We will look at the deep vein thrombosis for Doppler and the cardiac biomarkers for supportive care. So in this way, we can diagnose a pulmonary embolism has a mnemonic for memorization. So you can memorize this mnemonic in order to diagnose a pulmonary embolism, and we will have to evaluate the